we'll be discussing about certain details about the superperiosteal technique. This is more commonly called the local infiltration, but it is incorrectly. It is the most commonly frequently used technique for obtaining pulpal anesthesia in a maxillary teeth. Although it is simple procedure with a high success rate, there are several valid reasons for using other techniques whenever more than 2 or 3 are involved in treatment. The superperiosteal injection is indicated whenever dental procedures are confined to a relatively circumscribed area in the maxillary or mandibular incisor region. For the nerves anesthetized for this technique is the terminal large branches of the dental plexus. The areas anesthetized includes the pulp, the root area of the tooth, buccal periosteum, connective tissue, mucous membrane. For the indication of this technique, pulpal anesthesia of the maxillary teeth when treatment is limited to 1 or 2 teeth. Soft tissue anesthesia when indicated for surgical procedures in a circumscribed area. For the contraindications, infection or acute inflammation in the area of infection. Next is the dense bone covering the apices of the teeth. For the advantages, there is high success rate, technically easy injection, and usually entirely automatic. And for disadvantages, not recommended for large areas because of the need of multiple injections. And then lastly, the necessarily to administer a larger volume of local anesthetic. Hello, we will be about to demonstrate to you one technique for anesthetic technique. It's called the inferior superperiosteal technique. First, we'll be introducing to you the basic or the required armamentarium for this technique. First we need is the basic instrument, the mouth mirror, the explorer, and the cotton plier. And then 2 swabs for application of the topical anesthetic and antiseptic. Then we need the sterile cotton gauze, and then an extra cartridge for excess use, and then a short and long needle for other techniques if needed. And then our syringe. Also, alcohol and cotton and dispenser. Okay. Hello, we are about to demonstrate to you the proper positioning of the patient and the dentist itself. So for me, I am at the 8 o'clock position because it is an appropriate position for the technique we are about to demonstrate, which is the superperiosteal. And as you can see, the patient is in a supine position. So we'll be showing you about the area of insertion, the target area, and the landmarks of the superperiosteal technique. First is the area of insertion is the height of the mucobuccal fold above the apex of the tooth, which here in 1-3 we showed here that this is the height, and this would be the area of insertion of the needle. And the target area is within, which is the apical region of the tooth to be anesthetized. So the landmarks is the mucobuccal fold, this one, and also the crown of the root, so that it would show as a guideline, and the root contour of the tooth, which is here, which would show you how it would be inserted in a proper position. So first, we are about to prepare the tissue at the site of injection. So first is we clean with a sterile dry gauze. We have to dry this part so then the topical solutions would be absorbed rapidly. We use a cotton swab to apply the topical antiseptic at the part to be injected. So we wait for a few seconds for the antiseptic to be absorbed. We do not want to let the area to get wet again. For the next topical is we are about to apply the anesthetic. Then we wait for 1 minute. So we orient the needle so the bevel faces the bone. As you can see, there is a black marker which indicates where the bevel is located for easier indication. We place this and then we orient this needle which faces the bone here. So we lift the lip, pulling the tissue taut. Hold the syringe parallel to the long axis of the tooth. We insert this 27-gauge short needle into the height of the mucobuccal fold over the target of the target tooth. We advance the needle until the bevel is at or above the apical region of the tooth. Then we aspirate, and if it is negative, we deposit approximately 0.6 ml or 1/3 of the cartridge slowly for over 20 seconds. We do it slowly so then the tissue won't be causing any balloon. And then we slowly withdraw the syringe and make the needle safe using a scoop technique. And then we wait for 3 to 5 minutes before starting the procedure.